To my colleague from Texas, Mr. Flores.
Thanks, Ms. Black. One of the comments from the other side said that this discussion on this motion has to do with real-life struggle of Americans. And yes, it does, and it's because of the failure of the Democrat economy and the Obama economy. The best solution for women's health is higher income for American middle-class families. In other words, more paychecks instead of more welfare. Instead of more federal debt. It's more opportunity for families and less debt for our children and our grandchildren. Under the Reagan recovery, the net worth of middle-class families grew by 27%. If we were following the Reagan recovery today, if we were on the same track that recovery was, we'd have over 16 million more Americans working. We'd have a more robust economy. And that's what I call a balanced approach. And we'd have more money to pay for women's health and everybody else's health. If we'd substantially reduce our unemployment rate. We'd be having growing middle-class incomes instead of shrinking middle-class incomes. And provide more health care resources for women's health. Alternatively, Democrats want to corrupt an already bloated tax code with more onerous regulations to shove more jobs overseas, to shove more investment overseas, and to run more corporate headquarters overseas. That's what happens when you corrupt this tax code more than it's already corrupt. I agree with Mr. Van Hollen. I want to get rid of corporate tax loopholes, but I want to do it the way we proposed in the Republican Path to Prosperity budget, and that's massive tax overhaul so that everybody's paying at a simplified, flatter rate, and we have greater economic activity out of this, and we have greater revenues to the federal government because we have more people working and more economic activity, not because we have higher, more corrupt tax rates and a fatter tax code. We ought to be able to do the tax code in the same number of words we have the Constitution done. So, more women's health care comes from a more robust health care system that are run by, that are controlled by consumers. Not from a top-down Obamacare type of solution where the federal government picks the winners and losers and who gets health care, who gets scarce health care, and who doesn't. If you want to, and which is going to cost 2 times more than was originally forecast, that's going to hurt women's health care. I want my granddaughter that's 14 months old to have great health care, but it's not going to come from Washington, D.C. We've already talked earlier in this discussion today. Americans don't trust Washington solutions. They want Main Street solutions. So again, if you want a balanced approach, let's go revenues through comprehensive tax overhaul, and let the private sector work this out instead of Washington trying to think they can do it. We've already seen what Washington does with GSA and TSA and all the other initials I named in the last discussion. With that, I yield back.
Thank you, Mr. Flores.